So today we will be learn about pectoral region. So pectoral region, it is present in the anterior region on the front of thorax. So it is present in the anterior region on the front of thorax. Now what are the surface landmarks of pectoral region? So the surface landmarks of pectoral region are number 1 clavicle, number 2 suprasternal notch or also called as jugular notch, number 3 sternal angle or angle of Louis, and number 4 infraclavicular fossa, number 5 coracoid process, number 6 nipple. Now clavicle. So clavicle, it is subcutaneous throughout and it is palpable along the whole length and it is present at the junction of root of neck and front of chest. So clavicle, it is subcutaneous throughout and palpable along the whole length and present at the junction of root of neck and front of chest. Suprasternal notch or jugular notch, it is a palpable notch and it is present at the upper border of manubrium sterni between the medial ends of the two clavicle. So it is a palpable notch present between the upper borders of the manubrium sterni between the medial ends of two clavicle. So as you can see here, so this is the suprasternal notch or also called as jugular notch. Now next, sternal angle or angle of Louis, that is, it is a transverse ridge 5 centimeters below the suprasternal notch. So it is a transverse ridge present 5 centimeters below the suprasternal notch and it marks the junction of manubrium and the body of sternum. So the sternum has two parts, that is the manubrium and body. So it is present between the junctions of manubrium and body of sternum. Now what is the significance of this sternal angle or angle of Louis? So the costal cartilage of the second rib, articulates with the sternum. So the costal cartilage of the second rib articulates with the sternum, that is articulates with the sternal angle of Louis. So it helps, this landmark is used to identify the second rib and helps in the counting of ribs. So this landmark, that is the sternal angle or angle of Louis, helps in identification of the second rib and helps in counting of ribs. Now infraclavicular fossa. So infra means below, clavicular means clavicle, and fossa means depressed area. So it is a triangular depression below the junction of middle and lateral third of the clavicle. So infraclavicular fossa, it is the triangular depression between the junction of the middle and lateral third of the clavicle. Now what is coracoid process? It is a tip of it. The tip of coracoid process can be felt in the infraclavicular fossa 2.5 centimeters below the clavicle. So the tip of the coracoid process can be felt in the infraclavicular fossa 2.5 centimeters below the clavicle. Now nipple, it is the most important features of the pectoral region. Location in males, it is present in the fourth intercostal space medial to the mid-clavicular line. So it is present in the fourth intercostal space medial to the mid-clavicular line. So in females, it can vary considerably in them. So in females, it can vary. Next, lines of orientation. So mid-sternal line, mid-clavicular line, anterior axillary line, mid-axillary line, and posterior axillary line. So these are the 5 lines of orientation. So mid-sternal line, it runs vertically downwards in median plane on front of the sternum. So as you can see in this diagram, the mid-sternal line, it is a vertical line that runs downwards in between the sternum. So mid-sternal line, that is runs vertically downwards in the medial plane on the front of sternum. Mid-clavicular line, it runs vertically downwards from the midpoint of the clavicle to the mid-inguinal point. So the mid-clavicular line, it is present, it is a vertical and runs downwards between the midpoint of the clavicle towards the midpoint inguinal canal. So mid-clavicular line runs vertically downwards from the midpoint of clavicle to the mid-inguinal point. Now anterior axillary line, it runs vertically downwards. It runs vertically downwards from the anterior axillary fold, which is formed by the pectoralis major. So the anterior axillary line, it runs vertically downwards from the anterior axillary fold and formed by the pectoralis major. So as you can see here, it is the anterior axillary line. So it is run vertically downwards and forms anterior axillary fold and formed by the pectoralis major. Mid-axillary line, as you can see here. So it is present, it runs vertically downwards from the point located midway between the anterior axillary fold and the posterior axillary fold. So mid-axillary line runs vertically downwards from a point located midway between the anterior axillary fold and the posterior axillary fold. Now what is the posterior axillary fold? So this also, it is runs posterior axillary line, so it runs vertically downwards from the posterior axillary fold formed by the trapezius and teres major. So posterior axillary line, it runs vertically downwards from the posterior axillary fold formed by the trapezius and the teres major. The anterior axillary fold is formed by the pectoralis major muscle. Now the cutaneous innervation of the pectoral region. So as you can see here, a horizontal line is passing through the sternal angle or angle of Louis at the C4 and T2 junction. So the area above this horizontal line is supplied by the supraclavicular nerves, that is the area C3 and C4, they are supplied by the supraclavicular nerves, and the areas present or the shaded areas present below the horizontal line, they are supplied by the anterior and the lateral cutaneous branches of the second and the sixth intercostal nerve. So anterior and lateral cutaneous branches of the second and the sixth intercostal nerve, they supplies the segment below this horizontal line which is present at the junction of C4 and T2 segments. Now, the nerves which are derived from the C5 to T1 spinal segment forms the brachial plexus. So, the nerves derived from C5 to T1 spinal segment forms the brachial plexus. Now, next. So, the muscles in the pectoral region are four muscles. They are the pectoralis major, pectoralis minor, subclavius and serratus anterior. Serratus anterior, it is used for studying purpose, although it is not a muscle present in the pectoral region. So muscles in the pectoral region are pectoralis major, pectoralis minor, subclavius and serratus anterior. Now pectoralis major, it is also called as breaststroke muscle, and it is the largest muscle of the pectoral region. So pectoralis major, breaststroke muscle, largest muscle of the pectoral region, and it is a thin fan shaped muscle. So pectoralis major muscle is thin and fan shaped muscle, and it has two heads, the small head called small clavicular head and large head called sternocostal head. So it has two heads, that is small clavicular head and large sternocostal head. Now we will learn about origin. So the small clavicular head, it originates from the medial half of the anterior aspect of the clavicle. So it originates from the small clavicular head, originates from the medial half of the anterior aspect of clavicle. So as you can see here, this is the clavicular head of the pectoralis major muscle. So it originates from the anterior aspect of the medial half of the clavicle. So it originates from the anterior aspect of the medial half of the clavicle. So the clavicular head of the pectoralis major muscle originates from the anterior aspect of the medial half of the clavicle. Next. So the large sternocostal head, it originates from the lateral half of the anterior aspect of the sternum up to the sixth costal cartilage. So lateral half of the anterior aspect of the sternum. So originates from the lateral half of the anterior aspect of the sternum up to the sixth costal cartilage. So as you can see in this diagram, it originates from the lateral and the anterior aspect of the sternum till it is present till the sixth costal cartilage. Next. And also it originates from the aponeurosis of the external oblique muscles. So origin, small clavicular head which is originates from the medial half of the anterior aspect of the clavicle, and large sternocostal head which originates from the lateral half of the anterior aspect of the sternum up to sixth costal cartilage, and the costal cartilage ribs, that is 2 to 6, are also the original, also from which the large sternocostal head originates, and the aponeurosis of the external oblique muscles is also from where the large sternocostal head originates. Now inserted, so where all this origination gets inserted. So the pectoralis major muscle, it is inserted by the U-shaped bilaminar tendon on the lateral lip of the intertubercular sulcus, that is the bicipital groove. So the pectoralis major is inserted by the U-shaped bilaminar tendon on the lateral lip of the intertubercular sulcus by the that is also called as bicipital groove. So let's see in the diagram. So this is the bicipital groove present in the humerus. So as you can see here, the pectoralis major muscle gets inserted on the lateral lip of the bicipital groove. So this is the bicipital groove of humerus, and here the pectoralis major muscle gets inserted on the lateral lip of the bicipital groove or the intertubercular sulcus present in the humerus. Now, so this is the insertion. So the anterior lamina, it is formed by the clavicular fibers and which is thick and short. So the anterior lamina, which is formed by the anterior lamina of the tendon, this U-shaped bilaminar tendon, it is formed by the clavicular fibers and which is thick and short. And the posterior lamina of this bilaminar tendon is formed by the sternocostal and aponeurotic fibers, which is thin and long. Okay, then the nerve supply of pectoralis major muscle, it arises from the brachial plexus, and that is nerve supply, it is supplied by the medial pectoral nerve which arises from the medial cord of brachial plexus, and the lateral pectoral nerve which arises from the lateral cord of brachial plexus. So the nerve supply of pectoralis major muscle are medial pectoral nerve and lateral pectoral nerve. Medial pectoral nerve arises from the medial cord of brachial plexus, and lateral pectoral nerve arises from the lateral cord of brachial plexus. Now the actions. The actions also, clavicular head, it helps in the flexion of humerus. Flexion of humerus. So as you can see here, as the contraction occurs, it helps in the flexion of humerus. That is, the angle between it decreases. Now also the sternocostal head, it helps in the adduction of the arm. So as you can see, shoulder adduction, that is it moves towards the midline or the midline of our body, so that is called adduction. So shoulder adduction, so as the contraction happens, the shoulder adduction takes place. And next, the medial rotation of the arm. The sternocostal head also helps in the medial rotation of the arm. As you can see here, this is the medial rotation of arm. As the contraction takes place, the sternocostal head contracts, the arm rotates medially, that is towards the midline of our body or the mid axis. Now, the blood supply of pectoralis major, it is a thoracoacromial artery. So, the blood supply of pectoralis major muscle is the thoracoacromial artery. The blood supply of pectoralis major muscle is thoracoacromial artery. Now, what are the clinical aspects? In some cases, the sternocostal part of the pectoralis major muscle is absent and at the birth. So, it causes weakness in adduction and medial rotation of arm. So, sternocostal part of pectoralis major is absent sometimes at birth. So, this causes weakness in adduction and medial rotation of the arm. So, now we will learn about the another muscle, that is the pectoralis minor muscle. So it is called a key muscle. Why it is called as key muscle? Because it divides the axillary artery into three parts. So pectoralis minor muscle, it is a key muscle and it divides the axillary artery into three parts. Now its shape, it is small triangular muscle. So it is small triangular muscle and location, it lies deep to the pectoralis major muscle. So where it is located, it lies deep to the pectoralis major muscle and it is a small triangular muscle. So its shape is small triangular muscle and location lies deep to the pectoralis major muscle. Now, origin, it arises from the third, fourth and fifth ribs near the costal cartilage. So it arises from the third, fourth and fifth ribs near the costal cartilage. So what is the origin of pectoralis minor muscle? That is, it arises from the third, fourth and fifth ribs. It arises from the third, fourth and fifth ribs near the costal cartilage. And what is the nerve supply? What is the nerve supply? Nerve supply is median and lateral pectoral nerve. So nerve supply is same as that of the pectoralis major muscle, that is the medial and lateral pectoral nerve. Now what is the action? Now, what is the action of pectoralis minor? So it helps the serratus anterior muscle and protracts the scapula, that is draws the scapula forwards and helps in the punching action. So it helps the serratus anterior muscle in drawing the scapula forward, that is protraction, and helps in the punching action. And it acts as an accessory muscle of respiration, that is forced respiration, it acts as an accessory muscle. So pectoralis minor muscle helps serratus anterior in drawing the scapula forward, that is the protraction, and helps in the punching action. And it acts as a accessory muscle of respiration, that is forced inspiration. So as you can see here, it is the pectoralis minor muscle. So pectoralis minor muscle. So where it gets inserted, the pectoralis minor muscle gets inserted in the medial and upper surface of the coracoid process of scapula. So the pectoralis minor muscle gets inserted in the medial and the upper surface of the coracoid process of the scapula. So as you can see, this is the coracoid process of scapula. So and here the pectoralis minor gets attached on the medial and the upper surface of the upper part of the coracoid process. So medial and the upper part of the coracoid process, the pectoralis minor gets attached. So this is also the diagram which shows the pectoralis minor is attached to the coracoid process, that is the medial and the upper part. It is medial and the upper aspect, it is connected. Pectoralis minor muscle is connected. Now as you can see here, it originates from the third, fourth and fifth ribs near the costal cartilages. So it originates from the pectoralis minor muscle, originates from the third, fourth and fifth ribs near the costal cartilages. Now also action acts as an accessory muscle of respiration, forced inspiration, and also it helps pulls the scapula downwards. As you can see here, it is connected to the coracoid process of scapula. So when it will contract, when the pectoralis minor muscle will contract, it will pull the coracoid process of the scapula downwards, so thereby pulling the scapula downwards. So helps in the depression, it depresses the scapula. So it helps in the depression movement of scapula. Thank you.